All your friends and family, check in on your mother. She wants to hear from you right now. And speaking of mothers, we need you to do this, if not for yourself, then for your abuela. Do it for your granddaddy. Do it for your big mama. Do it for your pop-pop. We need you to understand, especially in communities of color, we need you to step up and help stop the spread so that we can protect those who are most vulnerable.
You likely remember those words from the U.S. Surgeon General on April 10th, 10 days ago. And he's one of the highest-ranking African Americans in the Trump administration. Dr. Jerome Adams is the 20th Surgeon General of the United States, who was appointed by President Trump back in 2017. Now he's been thrust into the spotlight as a member of the coronavirus task force. He's often seen at the daily task force press briefings next to President Trump. I spoke with Dr. Adams earlier today, and he had a lot of information specifically for the community.
Well, it's widely known that in the African American community, we have been experiencing higher rates of people being affected by COVID-19. How is the administration addressing that?
Well, thank you for that question. And this is an issue I've been passionate about throughout my career, working at a county hospital in Indianapolis, where we took care of the underserved, working as Surgeon General on issues like maternal mortality, infant mortality, and the opioid epidemic. And what I would say to people is, while the statistics are shocking, for instance, in Milwaukee County, African Americans represent 25% of the population, but about 50% of the cases and about 75% of the deaths. And we're seeing trends like that all over the country. These are shocking numbers, but they shouldn't surprise us because we've seen these disparities for over 100 years in our country. And so we're focused on a couple of different things. Number one, we're focused on the fact that comorbidities like heart disease and lung disease and diabetes put people at higher risk. And we need African American communities in particular to understand that many people in your communities are going to be at higher risk in our communities. My mother just had a stroke. I've shared with people that I have asthma and I'm pre-diabetic. We have to understand that we are at higher risk. And I think there's a real opportunity here to shine a light on some of these issues so that we can not just get through COVID, but also put ourselves in a better position to be healthier down the road. But the other important part of this is that in many cases, African Americans and people of color are in communities that don't give them the same opportunities as everyone else to be healthy. We know that only 1 out of 5 African Americans has a job where you can telework. So one of the guidelines that we put out there for staying healthy is to work from home. 5 out of 6 African Americans or 4 out of 5 African Americans can't do that. We know that we also tell people to not congregate in densely packed areas, but many African Americans live in multi-generational housing, and through gentrification have been pushed into more and more tightly packed areas. So we're looking at the societal issues while also trying to help address simple issues like making sure you get screened for blood pressure and take your medications as prescribed by your doctor, so that from all angles we can try to help people be healthier.
Interesting that you bring up societal issues. One of the recommendations has been to wear a mask, or if you don't have a mask, to wear a bandana, a face covering. There are many African Americans who simply don't feel comfortable going out with face coverings because there may be racial profiling. How do you address that?
Well, that is a great question, and it's one that I just honestly don't have a fantastic answer for, because I've experienced racism growing up. I've been profiled growing up, and I understand that concern that people have. What I would say to them is that understand, number one, that you're wearing a mask more to protect other people from you being an asymptomatic carrier than to protect yourself based on the scientific data. It's not a substitute for staying at home. So the most important thing you can do is to stay at home. And beyond that, I can just only express my sympathy and my true empathy, having grown up as a Black man, and to say, we make choices every single day, and we just want you to be as safe as possible. And if you don't feel safe wearing a mask, then I'm not going to tell you that you should do something that you should feel unsafe doing.
Do you feel optimistic about the situation? We're hearing in some parts of the countries it's better than others. They've already started. President Trump has brought forward this Reface program to try to reopen the country. What's your optimism level right now?
I'm actually optimistic because the original projections were of hundreds of thousands, and by some projections, millions of people dying. But because the country has really rallied around mitigation, has really rallied around staying at home and doing the things that we told them to do. The death rates have been lowered significantly. In Italy, there were people who couldn't get a ventilator. In the United States, that hasn't happened largely because we haven't overwhelmed our healthcare system. And we've seen that the numbers are starting to go down nationally, but now is not the time for complacency, particularly in communities of color. Now's the time for us to really understand that good old public health works. What your mother told you. Wash your hands, stay away from strangers. Those things actually are effective in preventing the spread of coronavirus. And if we continue to do those things, while also being very intentional and careful and data-driven about when and where we reopen, then we will see ourselves on the other side of this. And here's what I'm actually really optimistic about, what we talked about earlier. I think there's an opportunity to shine a light on hypertension, to shine a light on lung disease and the fact that African-American communities have had tobacco marketed to them in ways that other communities haven't for a long time, to shine a light on diabetes screening. And if we can do those things through the lens of COVID, we may actually save more lives in the long run than what we would have been able to had we not had this opportunity. So a lot of reasons for optimism, a lot of reasons for sorrow, with 40,000 people dead and a disproportionate number of them people of color. But I do think there's a light at the end of this tunnel, and we will get through this together.
So glad to hear that. I'd also like to give you the opportunity to clarify some of your comments that some people may or may not have taken out of context, where you referred to Big Mama and things like that. Can you tell me the context that you meant those words in?
Well, first of all, it's important for people to know that I always speak from my own personal experience. I try not to pander to anyone. And the terminology that I use is terminology that we use in my own family. My mother and my grandmother both have the same first name, and so we use that terminology in our family. I try to personalize things because I want people not to see me as some unapproachable government figure, but someone who lives through this. My brother is involved in the criminal justice system due to substance misuse. So I talk about substance misuse from a very personal place. I have an uncle who's in a nursing home right now due to his alcoholism. Again, these are personal issues to me. And I want to say to your viewers, I apologize if anyone took offense. It's always a delicate line you try to walk between personalizing things and making it seem like you're blaming people. And that was never my intent. My intent was to lift up disparities and to lift up these social ills that actually put people in positions to have those disparities occur at higher rates. And I commit to working with communities of color, and particularly the African-American community, to continue to try to shine a light on these issues and to give people the best chance to be healthy. So thank you for the opportunity to clear that up. And I would also just ask people to look at the actual remarks where I talked about my experience with asthma, where I talked about my family, because in many cases, people are reacting to other people's characterizations of the remarks and not the actual transcript of the real remarks, where I laid out the disparities, the social ills, the things that we're doing to address housing and transportation. And I specifically said Black people aren't to blame for these issues. But I also want us to understand that there are things that we also need to pay attention to in our own lives to try to be as healthy as possible while we also address these larger social ills.
Well, thank you for clarifying that. I believe that people will appreciate that, and knowing that it's coming from an act of kindness and sympathy as opposed to maliciousness or lack of understanding. I think people do appreciate that.
Thank you for the opportunity. And again, I promise you that I will work with all communities, and particularly communities of color, to make sure everyone has the best chance to be healthy.
So finally, how are you and your family doing personally?
Thank you for that. I have a 15, a 14, and a 10-year-old. I'm the first Surgeon General in recent history to have school-age kids. And so I'm dealing with that also. I'm dealing with my kids at each other's throats in the midst of social distancing, and a wife who's really trying to hold down the fort while I'm gone all the time doing TV appearances and working on the task force. And so we're hanging in there. We're hanging in there with prayer. We're hanging in there with the support of others, and we try to do Zoom meetings and connect with other family members. But I can appreciate as much as anyone how difficult it is to try to deal with this unique time in our history. But I also feel like we will get through this. We are seeing a light at the end of the tunnel.
Wonderful.
The U.S. Surgeon General is the nation's doctor and oversees the U.S. Public Health Service Commission Corps, which is an elite group of over 6,000 uniformed officers who are public health professionals. Their mission is to protect, promote, and advance the health of our nation, which is so critical now. And that is the job that Dr. Jerome Adams says he wants to do.